Today's topic is abortion due to Q fever, that is coccidiosis, which is known as coccidiosis in most of the time in case of the animals. In case of this abortion, infectious and non-infectious causes are there. Wherever today we are going to target the infectious cause, that means one portion of that infectious cause, that is the Coxiella burnetii, which is responsible for the abortions in sheep food. If suppose we will see towards the synonyms which are used most of the time in case of Q fever, that is goat flu, because it gives flu-like symptoms. Squirry fever, because when it was introduced historically, when we will see, there was a question, what is the positive agent? Why it is not known? So because of that, it is known as the query fever also. It is also known as abattoir fever, because most of the time it is, that means maximum type of the percentage of the prevalence, it is observed in case of the abattoirs, and it is occupational disease also for the abattoirs. 9-mile fever, coccidiosis, burnett's, rickettsiosis, Balkan influenza, and pneumorickettsiosis. If suppose we will see in case of the synonyms, there are maximum time we are use the term, word that is the rickettsia, because it is before some years or before some years we can say that it was classified in case of the rickettsia, but now it is known as the gram-negative bacteria. Coming towards the history of the disease, that means in 1935, it was first described by the Edward Holbrook in the slaughterhouse workers. That means just in synonyms, we have seen that it is also known as the abattoir workers disease, because this is only the reason why it is known as the abattoir workers disease. And another important thing is that it is the occupational disease also. Q fever, which stands for the query and was applied at the time when the causative agent was unknown for the people, or we can say towards the scientist. The Q fever was discovered in 1937 by the Frank McFarland Burnett and the Mavis Freeman, which isolated the bacteria from the patients first time. And according to that, the name Burnett, whatever we are using, that is also given to this. Originally, it was identified as a species, as I just now told you, and currently the term Q fever is more associated to infection in case of human being, whereas coccidiosis is applied specifically in case of the animals. Coming towards the etiology, that means how this pathogen is, or where the classification, where we have to go for the classification of this, that is the Coxiella burnetii, which is gram-negative obligate intracellular bacteria. Intracellular is most important, because most of the time go for it is very easy to isolate and all that thing, because as it is the intracellular bacterium, it's very difficult for the isolation of the organism. This is also known as the occupational or foodborne bacterial zoonotic. That means it is responsible for the occupational type of the condition, foodborne type of the conditions, and it is given by OI, that is the notifiable. It is distributed worldwide except New Zealand. That means most of the time, most of the country it is giving the prevalence of the coccidiosis, or we can say the Q fever. It is observed endemic in many countries. And in case of our country, or in some countries, it is also, in today's date also, it is termed as the neglected zoonosis. Somewhere it is reported sporadic or unexpected type of the outbreaks, and the mortality rate is 1 to 11%. When we will see the classification on the basis of the biodynamic agent, it is highly infectious, and according to that, it comes under the category B agent. And because of that, this is also known as the that means most important potent for the bioterrorism paper. It is also used as this. This is the, we can say that electronic microscopic observations of the Coxiella burnetii. In case of animal population, that means specifically in cattle, sheep, and goat, natural infections are observed. And most of the time, the organism sheds the pathogen or the cells in the birth products, or we can say in case of the excretions and secretions also. In birth products, most of the time it is observed in placentas and amniotic fluids. It is also observed in case of feces, urine samples, and the milk of infected animals also. And because of this, if suppose we will see this all type of the material which is responsible for the transmission, we can say that these organisms, because of this only, it is having the foodborne infections. It is responsible for the foodborne infections, and it is giving you the environmental contaminations also. The bacteria usually affects mononuclear phagocytes, but can also infect the other cells also. It is highly infectious agent, in some cases requiring less than 10 bacteria to infect any type of the persons. In addition to that, I can say that one cell of the organism is also responsible to give infection to the other organism. The Coxella barnata shows tropism for the reproductive tissue and the mammary glands also, and therefore primarily shed during parturition and via the milk of the infected animal. Abortions is defined, as we all know, expulsion of the fetus before end of the normal term of the pregnancy. And coming towards the causes of the abortions, it may be non-infectious and it may be infectious also. In case of non-infectious, it may be because of trauma, nutritional deficiencies, managemental practices, and wherever in case of infectious ones, there are some type of the pathogens which are listed here, that is Brucella, Campylobacter, Chlamydia, Coxella, Listeria, and Toxoplasma. In addition to that, there are some other pathogens also like parasites and all that things. Most of the time, if suppose we will see the Coxellosis, in case of livestock, that means 50%, near about 50% of the population may get infection because of this Coxella. Mostly abortions because of the Coxella is observed in the last trimester of the pregnancy. And this is the most important reason which is giving maximum production loss. Now, in case of this, there are the chances to have some type of the confusion, that is, it is because of the Brucella or it is because of the Coxella. Because most of the time, both are giving abortions in the last trimester only. So for that purpose, we will see that means which type of the things are important. Now, this is the, in short, I have given some of the cycle. That means not exactly the cycle, how the diseases, how the cells are transmitted or they are present in the environment. We can see that the animal who is infected, that animal is giving shedding the cells in the environment, and that environment, that means the vines and all that things, is responsible to infect other animals which are available in the flock, as good as the persons who are working there at the farm. In addition to that, nearby residential areas also through the vine. Now, during parturition, we all know that there is huge concentration of the material which is released, and in the form of amniotic fluid and all that things. In case of this, the Coxella is giving 1 billion per gram, which is most of the time observed in case of the amniotic fluid and the placenta. This Q fever can also spread by ticks, which pass the bacteria from an infected to a susceptible animal and whose species contain the bacteria and contaminate the environment. In case of this, ticks, Haemaphysalis humerosa, Haemaphysalis vapsna, and Rhipicephalus dermatocentus may be capable for transmitting the Coxella barnata. When we will see the classification and all that things at that time, it is identified 40 species of the hard ticks and 14 soft tick species which are involved in the transmission of the Coxellosis. So we say that infected animal can persistently shed pathogens in their milk for several months without any clinical signs or symptoms, while shedding through vaginal mucus or feces is sporadic or intermittent in the nature. And because of that, it is having very much important in case of the transmission of, that means in case of the zoonosis also. Now, coming towards the zoonotic point of view, when you will go, infection in case of human usually occurs through the ingestion of the bacteria from air, as just now we have seen the cycle, or the dust contaminated with the feces, urine of the infected animals. And other mode of transmission are there, that is tick bite, consumption of the unpasteurized milk or the dairy products. Human to human transmission is not reported, or where we can say, but till now, whatever the readings are having, there is not any type of the human to human transmission. Rarely, Q fever can be spread through blood transmission from pregnant woman to her fetus and the sex. Most common route of transmission to human is during parturition of the animals, that means the workers who are working there and the other people nearby. This is the cycle we can see there, and in this cycle, you can see that all the type of, that means domestic cycle, predator cycle, sylvatic cycles are involved for the transmission of the Coxellosis, or we can say the Q fever. As ticks are responsible for the transmission, most of the time the ticks are observed in the sylvatic one. That means from wild animals to the domestic or from domestic towards the wild animals. Likewise, predators, that is the dogs, cats, are also responsible to have the infections. That may be from the wild animals or from the domestic animals also. In case of humans, if suppose we will see towards the humans, it may be because of the inhalation of the contaminated aerosols. It may be because of the direct or indirect contact with the contaminated placenta, aborted material, urine, feces, manure. That means most of the time because of this only we are saying that this is the occupational type of the disease, because the farmers or the farm workers or the veterinarians, they are routinely coming in contact with all these things. Ingestion of the contaminated and unpasteurized products, that means the common people, if suppose they are having the habit to have the unboiled, or that means they are drinking as such the raw milk and using some type of the raw dairy products without any type of the pasteurization and all that things, they are having the chances to have the infection if the animal is suffering from the Coxella infection. In addition to that, human to human transmission, if suppose we will see transmission, sexual transmission, nosocomial infections are also there, and infectious partial women are also responsible for the transmission of the coccidiosis, or we can say the Q fever. As I just now explained, that is, this is the occupational type of the disease. Veterinarians, butchers, meat processing plant workers, dairy workers, livestock farmers, and the researchers are also may suffer from the disease condition. So for that, survey have shown that significant number of the livestock handlers have antibodies indicating exposure to the organism, and diverse range of hosts, that is cattle, dog, cat, rabbit, pig, horse, camel, buffalo, rodents, birds. That means this all the type of the animals may suffer, which included that means they may suffer from the coccidiosis. Coming towards the risk factors, that is occupations with increased contact with the animal or animal products, living in the rural areas or living in on or within the vicinity of the livestock farm, recent travel to the areas of higher risk for the Q fever, such as rural agricultural communities, that is also responsible. Sexual contacts with the persons who has recently had the Q fever or the contact with the contaminated clothing, there are the chances as the dust particles are transmitting organism. Coming towards the symptoms which are observed in case of the animals, that is, most of the time we can say that the animal is not showing any type of the symptom, that is asymptomatic. And because of this, it remains unnoticed in case of the animal population. When there is an abortion, at that time, that means if the farmer or the owner is interested to go for the screening and all that things, then only it is noticed. Identified only when spills into the human population through the zoonotic exposure. Because whenever, if suppose such any type of the unknown type of the fever and all that things, that it is not in a position to get cure, there are the chances to have the human doctor to give the samples for the proper diagnosis. And in case of that proper diagnosis, if suppose he suggests for the rickettsial diagnosis, at that time there are the chances to have the that means diagnosis for the coccidiosis, diagnosis for the Q fever, and through that there are the chances to go for the back tracing of the transmission. What is the that means how the human got infection, what are the chances, what is that means we can say the occupation, or there are chances to have, and through that there are the chances to get the prevalence or the chances of the having infection in the specific type of the herd. Humans serve as the sentinel for the disease activity, and because of that we are saying here that is it is known as the sentinel for this type of a disease. In case of this, there are two types of the phases we can say, that is acute and the chronic phase. In case of acute phase, one can have the fever, rapid respiratory rate, mild cough, rhinitis, and loss of appetite. Wherever in case of chronic one, infertility, abortions in the last trimesters. Abortions is most common in case of sheep and goat, and more than that means up to 50% of the pregnant animals may abort. Sometimes full-term dead or weak, or sometimes low-weight offspring, sometimes retained placentas also. It is usually asymptomatic in goats and sheep. Infected non-pregnant does not develop any type of the clinical signs. healthy animal can also shed if suppose once he has having, that means the animal is having some type Q fever infection, the infection can be lifelong. And according to that, only once there will be the what we can say abortion, afterwards there will not be any type of the abortion in case of the sheep and goat, and accordingly it will be healthy only. Only the thing is that the animal will secrete the pathogen in every type of the kid. Reproductive failures in case of goats, that is abortion, stillbirth, retained placenta, infertility, weak newborns, low birth weights. The doe become immune after the initial infection, but can shed the bacteria indefinitely in milk, urine, and feces, and at kidding time for the years. And because of that, it is having very important because it gives infection to the other healthy animals, and according to that, initially each type of the animal, that means each healthy animal, will show the abortion in the flock. Unexplained abortions in your goats could be caused by the Q fever. The bacteria causes inflammation and necrosis of the placenta in susceptible pregnant does, which results in case of the abortions. This is some type of the picture we can say that is the goat placenta. Most cotyledons have pale tan margins, and there are scattered raised tan discs. And according to that, that means when we will go for the PM and all that things, there are the chances to not the PM exactly whatever the material it is coming out. In that case, we can go for the such type of the observations. Otherwise, it's very difficult for the diagnosis. Less than half of the people infected become ill and show symptoms. Incubation period is of 2 to 3 weeks in case of the humans. It shows fever, chills, sweat, fatigue, headache, muscle ache, nausea, vomiting, diarrhea, chest pain, stomachic pain, weight loss, and non-productive cough in case of the occupational, or we can say the risk group persons. Symptoms can be mild or severe. People who develop the severe disease may experience an infection of the lung or the liver. Most of the time, the hepatitis and the pneumonia are the normal type of the, normally it is observed. The women who are infected during pregnancy may be at risk for miscarriage, stillbirth, preterm delivery, or low infant birth weight. Clinical manifestations of the humans, there are the chances to get placentitis, abortions, pneumonia, and endocarditis. In case of chronic Q fever, around 5% of the people develop a chronic form of disease called chronic Q fever. And this chronic Q fever develops months or years following the initial Q fever infection. People with chronic Q fever often develop endocarditis and infection of one or more heart valves. People with endocarditis may experience night sweat, fatigue, shortness of breath, weight loss, or swelling of their limbs. The people of the, that means these symptoms are most of the time observed in case of the occupational persons or the high risk group persons. Chronic Q fever is serious and can be deadly if not treated correctly. It requires months of antibiotic treatment. And the chronic Q fever is more likely to occur in people with heart valve disease, blood vessel abnormalities, or in people with weakened immune systems. Specifically, the women infected during pregnancy may also be at risk for developing the chronic Q fever. And in case of women also, there are the chances to have the abortions, specifically in the last trimester. Coming towards the diagnosis of the disease, which type of the samples to be collected? Samples in the form of placenta, vaginal discharges, tissues of the aborted fetus, in the form of spleen, lung, liver, and or stomach content. In addition to that, we can go for the collection of the blood and sera also. For shading purpose, if suppose we are interested to diagnose the flock, or we can say that means this is looking the healthy flock, and how to go for the diagnosis if suppose there are some type of the Coxella. In that case, we can go for the diagnosis for the shading purpose, and for that purpose we have to collect the samples which can be taken from the vagina, milk, and colostrum. In addition to that, here we can use the fecal samples also. Isolation, if suppose our interest is for the isolation of the organism, we can go for the cell culture, embryonated chicken yolk sacs, or the laboratory animals. But isolation of the organism, it is a tedious job, and in addition to that, we need BSL-3 facility in the lab also. Inoculation of the laboratory animals, that is, we can use guinea pig, mouse, hamsters, which gives helpful for the isolation of the tissues. So this is the slide. That means if suppose we are collecting the blood sample, and accordingly we can use it for the different type of the diagnosis in the form of the lab animal, in the form of the tissue culture inoculation, embryonated egg, or the serology purpose. This is the slide which I use purposefully for the that means from the OIU manual, where we can, that means most of the time there are the chances at which stage we can go for the screening, which type of the test we have to go for the screening, which type of the test we should go for the what we can say the identification and the detection of the immune response. So accordingly, in case of this, in short, I can say that if suppose we are interested for the screening, we can go for the what we can say the PCR or the ELISA. But again, we need some specific type of the facilities available there. For PCR and ELISA, it's okay, we can go, but for the different one, there is a requirement of the money and all that things. If suppose it is in the case of IF, and IF is only possible in case of the humans, not for the animals. If suppose the veterinarian or the officer it is interested to have to identify the causative agent at the, because which is responsible for the abortion, at that time they can go for the preparation of the smears also, that means impression smears whenever there is an abortion, and according to that we can go for the staining also. That also there in my coming slides we will see that. The bacteria can be visualized in the stained tissues or the vaginal mucus smears through the stamp, or the in case of this modified Zell-Nelson and Gymnase or the GIMSA and modified poster. But when we will see, that means we will go for the sensitivity and specificity, having some type of the specificity, lacking in the specificity. Demonstration of the agent, we can go by immunohistochemical staining, by in situ hybridization, or by polymerase chain reaction, which is more specific and sensitive than the classical staining methods. Mostly in laboratory, for the screening purpose, we are going for the PCR based diagnosis, and in case of PCR based diagnosis, there we are targeting two type of the genes, that is the COM and the trans1. So according to this, most of the time, if suppose that means which type of the virulence it is available, if suppose the organism or sorry the animal is showing positivity for both the things, that means this type of the samples we can use for the further isolations also. So these two PCR-based tapping methods are becoming widely used, that is MLVA, that is multi-locus variable number of the tandem repeats analysis, and the multi-spacer sequence type also. But it's not possible for every type of the lab. Coming towards the serological diagnosis, we can go for ELISA, IFA, and CFD. The presence of specific antibodies, that is IgG antibodies, provides the evidence of a recent Coxiella burnetii infection or a past exposure, wherever ELISAs are preferred for the practical reason and for their highest sensitivity. Coming towards the treatment of the animals, there is not any specific assign or we can say specified label treatment available. But most of the time, the preference is given towards the oxytetracycline, and combination of the antibiotics is also used. If suppose any flock is positive or any animals, that means most of the time, if the number of positivity in the flock, that is more than 6 to 7 animals, if it is positive, and there are the chances to have the abortions in the last trimester, shown that the long-acting tetracycline at the rate of 20 mg per kg is used for the flocks which shows positivity for the coccidiosis. Most people who are at risk with Q fever will recover without antibiotic treatment because it remains unnoticed and all. And however, for people who develop Q fever disease, treatment with 2 weeks of doxycycline, it is given and it is recommended also. In case of chronic Q fever, a life-threatening infection requiring several months of the antibiotic treatment is required and treated with the combination of the antibiotic including doxy and the hydroxychloroquine is also given for the several months. For prevention and control, because most of the time whenever the coccidiosis or the Q fever it is there, it is preferred that prevention should be there because it is the best option. As we have seen that there is not some specific type of the treatment, because of that this is the best thing. Animals can be infected with Coxiella burnetii and appear healthy reduce your risk of getting Q fever by avoiding contact with animals, especially with animals while animals are giving birth. Do not consume raw milk or the raw milk products. Proper hygienic precautions while handling the parturiting animals. Training and awareness to the workers in the livestock farms, laboratories, and the dairies. Proper disposal of the contaminated waste from the animals. Here I can say that there is a requirement to have, that means everyone should maintain the protective, that means they should they should use the protective clothing whenever they are going for the specific type of the parturition and all that things. Of course, it may be known that is the animal is suffering from some type of the disease, or it may be unknown also. Thing is that if suppose unnoticedly there is not any type of the diagnosis and proper screening is not done, at that time it will be good for the worker also, and for the, that is specifically for workers, it is required. So everyone, every type of the risk group people should follow the things, that is they should use the proper type of the clothing, or we can say that PP. Not exactly as we was using at the time of COVID, but whatever it is required according to the distribution. Vaccine is not available for coccidiosis or Q fever. It is most effective, are composed of the inactivated whole phase 1 bacteria. Cocciva, it is known as highly effective. Vaccination does not clear infection in previously infected animals, and major problem impossibility of the distinguishing vaccinated and naturally infected animals, as we are doing in case of the FMD and all. It's not possible in case of this. As now no vaccine is available in our country, and coming towards the new vaccines, if suppose it is required, that is the recombinant vaccine under development and still requires an investigation for the effectiveness in the field conditions. And inactivated phase 2 vaccine, that is Clamig-Vac active, has also been tested on animals but has failed to give specific type of the effect. Specifically, prevention control in sheep and goat, most of the time it's common to that. Carefully clean all afterbirths and the affected bedding from any type of the abortion. Wear protective gloves and masks. Dispose of contaminated material by burning or burial. Isolate which are aborted from the reset of the birth. And according to that, in addition to this, I will say that if it is possible, it's good that means the animals which are shown the abortions, it should be kept in the separate one for some period of time, and accordingly they should be screened properly, and after screening only, if suppose it's possible to have some type of the treatment, then only it should be added. In addition to that, whenever there is entry of any new type of the animals in the flock, if suppose you have to enter, at that time also you have to take care. That means the animal should be screened properly. This is our routine protocol. SOPs is also given, not specifically for the Coxella or Q fever, but for any type of the animal, it is that means for any type of the disease condition, or we can say entry of any type of the animals, new animals in our herd, at that time it is required. So everyone has to follow whatever the SOPs is given, and then only it's possible to control and prevent such type of the abortions in your flock. Some challenges and strategies are there for control of the prevention, for prevention and control of the Coxella. That is variability of the antibody titers, and the lack of clinical symptoms frequently result in underreporting of the Coxella vernata, seroprevalence in ruminants and the humans. We are seeing in the last slides also, that is it reporting of the Coxella. It's not observed. Most of the time, the people who are doing research and all that things, they are only interested and they are only going for the such type of the screening, or they are just collecting the sample and giving results accordingly. Otherwise, if suppose we will see that means there is not any type of the veterinarian who is sending the sample for screening of the Coxella and all that things. So, and as it is not giving any type of the typical symptoms also, that is also the main reason which remained unreported in the country. It is necessary to devise more sensitive and precise diagnostic methods such as PCR and antigen detection tests to correctly identify the Coxella vernata infection in both animals and humans. The absence of adequate knowledge and the consciousness about the ailment among farmers, veterinarians, and public health officers is another hurdle. I will say that here it is required to have the One Health approach, and in addition to that, not going for the One Health approach, for that also it is required to have the training or the education or the awareness to the people who is regularly coming in contact with such type of the infection, or who are at risk group or who are at a risk. Good hygienic practices such as regular cleaning and disinfection of the animal premises can reduce the risk of environmental contamination and the transmission. Now, to control the One Health approach, vaccination, it is required, but vaccination for Coxella is not available. Environmental management, which is more important, as we have seen in the cycle, that is environment is the major problem. That is contaminated environment is the major issue for sharing of the disease or for transmission of the cells. And because of that, the environmental management, specifically at the farm site, it is required. Multisectoral approach or multisectoral collaboration, including joint research, is also required for the control of the coccidiosis, or we can say the Q fever. For that purpose, we can go for the policy and practice guidelines. It should be there. That means which type of the practices should be followed at the farm, and which type of the practices should be followed at the different type of the PSC centers also, and how to go for all the type of the screening and all. Because of that, we can detect it, we can report it, and accordingly we can go for, we can decide some type of the policies for the control of the disease condition. Information sharing and intelligence exchange is also required in between the humans and the veterinary doctors. Risk communications, of course, whatever the risk points are there, that should be discussed, that should be that means it should be given to the, that it should be shared with the common people also. That means these are the risks if suppose they are in and around of the any type of the farms and all that things. Joint interventions are required for the control of the disease. Evaluation of the disease regularly, it is also required there. Education and training, as I told in the last slide, is also education and training is very much important, specifically to the health workers. That health workers may be in the form of animal health workers, that may be in the form of the human health workers. Diagnosis, proper diagnosis and reporting is also important. So this is the flow chart where I have just tried to give how the initial reporting at the farm is important, which is giving the information towards the global level. And this is not only in the form of Coxella or for the One Health approach, it is required for all the type of the diseases wherever there is need of the notification. So from farm, it will go to, that means with a specific type of the surveillance, it will go towards the, that means it will come in the form of the data. That data will be shared with the different type of the agencies, and then it will shared with the at the national level. From national level, it can go towards the international level, and according to that, it will globally whatever the data it is given by the lower side, it will be published, and it will, that means as we have seen in the last slide, that means the policy decisions are required. So that can be done, or it can, that means on the basis of this, some type of the work will be done for to make the awareness, to make the prevention and controls. So accordingly, this One Health approach is also required towards the prevention and control of the coccidiosis, or we can see the Q. So this is all about the Q fever.